Hello and welcome back. Today, we're diving into one of the most critical issues facing seniors in 2025 and beyond: the future, Medicare prescription drug coverage. Here's the truth. Starting in 2026, Medicare Part D premiums are expected to rise sharply. This change could have a massive impact on millions of older adults who rely on affordable prescriptions to stay healthy and maintain their quality of life. If you or a loved one is enrolled in Medicare, or planning to be, you need to hear this, because what's coming could affect your wallet, your health, and even your independence. So, let's break it all down in clear, simple terms. What is Medicare Part D? First, let's make sure we're on the same page. Medicare Part D is the prescription drug benefit program. It helps cover the cost of medications that aren't included in standard Medicare Part A hospital coverage or Part B doctor visits. Part D is optional, but most seniors enroll because medication costs can be overwhelming without it. Currently, Part D is offered through private insurance companies approved by Medicare. That's why premiums and coverage can vary depending on the plan you choose. Why premiums are rising in 2026? Now here's the key question: why are we about to see such a big increase? It comes down to something called the Inflation Reduction Act, which was passed in 2022. This law made big promises to lower drug costs, and in many ways, it has helped. For example, it capped the monthly cost of insulin at $35. It gave Medicare the power to negotiate prices for certain high-cost drugs, and it introduced limits on out-of-pocket spending for seniors. But here's the catch: those lower premiums we're enjoying right now are temporary. From 2023 through 2025, the government gave extra subsidies to keep premiums stable. Think of it like a safety net. In 2026, those subsidies will shrink dramatically by nearly 40%. And when that happens, the real cost of prescription coverage will land back on seniors. How much could premiums increase? Let's put this into perspective. Right now, the average Part D premium is about $35 to $40 per month. Experts predict that in 2026, those premiums could jump anywhere from 20% to 50% or more, depending on your plan. For many seniors living on fixed incomes, even a $20 increase per month means choosing between medicine and groceries, or bills and healthcare. And it's not just premiums. Deductibles, copays, and coinsurance could also shift, making prescription coverage more costly. Health at serious risk. This isn't just about numbers, it's about real people making impossible choices. What options will seniors have? So, what can you do to protect yourself? Let's look at the options. 1. Reevaluate your plan every year. Medicare open enrollment happens every fall. Too many people just auto-renew their plan without looking at changes. In 2026, that could cost you dearly. Take time to compare premiums, formularies, the drug lists, and out-of-pocket costs. 2. Look into Medicare Advantage plans. Many Advantage plans bundle drug coverage, sometimes with lower premiums. But be cautious, these plans can have network restrictions and hidden costs. 3. Check eligibility for extra help. The Extra Help program, also known as the Low-Income Subsidy, is designed to help seniors with limited income cover Part D costs. Millions of seniors qualify but never apply. Don't leave this money on the table. 4. Use generic and mail-order options. Switching to generic drugs or using 90-day mail-order prescriptions can reduce overall costs. 5. Stay informed about negotiated prices. Medicare will begin negotiating drug prices for certain medications starting in 2026. If your prescriptions are on that list, you could see significant savings. Why advocacy matters. Now, let's zoom out for a second. This premium increase isn't just a personal issue, it's a political one. Seniors are the largest voting bloc in the country, and your voices matter. Organizations like ARP and the National Council on Aging are already pushing for extended subsidies and stronger protections. But lawmakers act when they feel pressure. That means contacting your representatives, sharing your story, and making your concerns known. Planning ahead financially. For many seniors, planning ahead financially is just as important as choosing the right plan. Start by reviewing your monthly budget. Ask yourself, can I set aside a small amount now to prepare for 2026? Talk to a financial advisor who understands senior healthcare costs. Even small steps now, like trimming expenses or building a medication fund, can ease the shock later. Emotional support and community. This is also about peace of mind. Rising healthcare costs can create stress, anxiety, and fear of the future. But remember, you're not alone. Millions of seniors are facing the same uncertainty. Community groups, senior centers, and online forums can be a source of support and shared strategies. Sometimes just knowing you're not the only one struggling can make the burden feel lighter. So, let's recap. Medicare Part D premiums are set to rise in 2026. Due to reduced government subsidies, seniors could face much higher monthly costs for prescription coverage. But by staying informed, comparing plans, and exploring financial assistance, you can prepare and protect yourself. Here's the bottom line: don't wait until it's too late. The best defense is knowledge and preparation. Now I want to hear from you. Are you concerned about rising Medicare costs? Do you feel prepared for what's coming in 2026? Share your thoughts and experiences in the comments below. Your story could help someone else. And if you found this video helpful, make sure to hit like, subscribe Timeless Truths, and share it with friends and family who need this information. Because when it comes to Medicare, the more we know, the stronger we are. Thank you for watching, take care of yourself, and I'll see you in the next video.